How to manage your child's ear infection. 4-year-old Sam had been suffering from a bad cold. He had a slight fever, just under 39 degrees Celsius. He was tired, cranky, and had begun complaining about a sore ear.
Maybe Sam has an ear infection.
Should we go to the doctor?
Ear infections, also known as acute otitis media, are an infection in the middle ear caused by a virus or bacteria. They often occur after your child has had a cold for a few days. Ear infections can be hard to diagnose. They are most common in young children and in most cases not serious. Children with an ear infection typically do not need to go to the emergency department, but they can be very uncomfortable for the child and stressful for the parents. Ear infection symptoms may include a mild fever, less than 39 degrees Celsius or 102.2 degrees Fahrenheit. Children who are old enough to talk might complain of ear pain. Children may also cry, be out of sorts, pull their ear, and have difficulty sleeping or eating. Symptoms are often worse at night. Sam's parents felt helpless watching Sam suffer and decided to go to the doctor. The doctor advised them that most ear infections clear up on their own in 2 to 3 days. The doctor suggested giving Sam children's Tylenol or children's Advil to help with fever and pain, and reminded them to follow the directions on the bottle. The doctor said that lying down flat can make the pain worse and suggested putting extra pillows under Sam's head. A warm pack on the infected ear may help ease any ear pain. The doctor gave them a prescription for oral antibiotics just in case he didn't get better. The doctor suggested they keep an eye on Sam, and if the pain and fever continued for another 48 hours, start the antibiotics right away. But if he improved over the next day or two, he'd get better without the help of antibiotics. However, if at any time they noticed fluid coming out of Sam's ear, they should return to the doctor, and if that happens at night, they can wait until the next day. The doctor said as long as Sam started feeling better, they did not need to come back. Sam stayed home from daycare for the next 2 days. The pain decreased and his temperature and irritability were gone, so Sam went back to daycare. Here's how to help your child with an ear infection. Make them comfortable. Prop them up in bed, try a warm pack on the ear, and give them children's Tylenol or Advil or equivalent medication to help with the pain. However, you should consider seeing a doctor if your child doesn't get better in 48 hours or has a fever higher than 39 degrees Celsius, 102.2 degrees Fahrenheit, or if fluid is coming out of your child's ear. If it's after office hours, you can wait until the next morning to see a doctor. You may be given a prescription for antibiotics, but be told to wait and only use the antibiotics if the fever and pain continue. Or they may want you to use the prescription right away. Always follow the doctor's instructions. And remember, most ear infections get better within a few days.